Hypnotherapy by Melissa Kozlowski. What is hypnotherapy? Hypnotherapy, or hypnosis, uses guided relaxation, intense concentration, and focused attention to achieve a heightened state of awareness that is sometimes called a trance. How does hypnotherapy work? Hypnotherapy works through suggestions that are made by a person doing the hypnosis. These ideas may include lifestyle changes, changes in fears, etc. The goal of hypnotherapy is to reprogram a person to overcome negative thoughts, feelings, fears, behaviors, and phobias. Their conscience is turned off and subconscious is turned on. There are two types of hypnotherapy: suggestion and analysis. In suggestion therapy, suggestion is used during the hypnosis to help stop a patient's bad habit. For an example, if a patient was trying to quit smoking but they can't with many failed attempts, they would see the hypnotist and they would practice making suggestions to them, such as smoking is bad for you or you should stop smoking, in hopes that this will help the patient finally quit. In analysis, it's the type of hypnotherapy where you get to the bottom of a problem you're having. An example of this is if a person's afraid of dogs and they have no idea why. When using hypnotherapy, it could bring back a repressed memory from the patient from when they were a child and maybe uncover a traumatic event that happened which led them to have this fear of dogs. Some facts about hypnotherapy. Hypnotherapy goes back many centuries, and it's been documented all over. Frank Mesmer in the 18th century was one of the first people to develop a method of hypnosis that was documented. Hypnotherapy can help with quit smoking, ADHD, phobias, relieve pain after surgery, depression, anxiety, OCD, insomnia, and those are just to name a few. Hypnotherapy is contraindicated in people who suffer from schizophrenia, alcohol or drug psychosis, bipolar conditions, and people who suffer from chronic pain that has not been investigated by a physician. Like many things, hypnotherapy does have some complications at times. Dizziness, headache, feelings of anxiety, stomachache, and false memories are some of the most common complications. When a patient is being seen for hypnotherapy, there are a few things that you do want to teach them prior to getting the hypnotherapy done. You want to inform them of the possible complications and side effects. You want them to have a clear mind and be able to concentrate before they come in. So them having a good night's sleep, doing things that don't stress them, trying not to maybe have caffeine before they come. Also, you want to educate them on the misconceptions of hypnotherapy. One of the big misconceptions is that the patients won't be in control of themselves or their own mind, which they are in control the whole time, so you definitely want to clear that up if they have any misconceptions about that. So with culture, I couldn't really find one specific culture that used hypnotherapy more than another. But I did come to the conclusion that people who live a holistic lifestyle were more likely to try hypnotherapy than people who didn't practice holistically. Also, I did a little bit of research on places in Buffalo that offer hypnotherapy. Two of them were Buffalo Hypnosis and Western New York Hypnosis and Wellness. So a research study that studied hypnotherapy was called Cognitive Hypnotherapy for Depression, an Empirical Investigation. This study compared hypnotherapy with cognitive behavioral therapy to treat chronic depression and to kind of see which one would be more effective. It studied 84 cases of chronic depression over a 16-week period. Within the 16 weeks, the patients either did hypnotherapy or cognitive behavioral therapy. These patients had to have been on some type of antidepressant for their depression, and they also have to have been seen by a doctor or psychiatrist. At the end of the research, the hypnotherapy showed a greater reduction in depression than the CBT did. It also showed reductions in the patients feeling hopeless and their anxiety.